And welcome back to Open Line. Over the last 45 minutes, we've been talking with Carol Westlake, the Executive Director of Tennessee Disability Coalition, about how COVID-19 can impact folks with disabilities here in Tennessee. And Carol, as we kind of move into yet another phase of the pandemic, we're starting to see a lot of federal recovery money come into the state and local communities as well. How can this potentially help or start kind of a new chapter as far as moving forward and getting out of the pandemic and helping people who have suffered because of it?
Yeah, so there really are some sort of exciting things that are happening. We kind of talk about the things that are challenging, but there's also some good things. And one of those is that part of the recovery money and the process, and because COVID is so healthcare related, is the opportunity for TennCare, the Medicaid program in the state, to be able to do some expansion of long-term supports and services for people with disabilities. So people who might need some in-home support, and that includes seniors, right, who might be disabled by age in one way or another, as well as adults with physical disabilities and some children. And the federal government is offering an enhanced matching program that's going to bring in about $400 million additional dollars pretty quickly into the state. And the TennCare Bureau is planning to use that to address people who are on the waiting list for services, who need those services and haven't been able to get them, for example. And so I think that's going to be just really, really important. They're also going to be working on doing some things to address sort of a workforce crisis. I think we've all heard, over the pandemic about sort of the Great Resignation and about, how that we're having jobs are going unfilled and one thing and another. And that's really been true in the world of long-term care or long-term supports and services. So whether it is in-home nurses or CNAs, nursing assistants, or direct support professionals, the personal assistance kinds of things, we haven't always paid really well for those, and as the salaries or wages go up in restaurants and other kinds of places to draw people, we've got a real crisis in not having enough folks that are helping people with disabilities and seniors get the services they need. And so there are some plans to use some of that money to be able to enhance wages in long-term care, which is going to be really, really important, and to be able to begin to build that workforce so that more people will be able to get the services they need. So that's been a really exciting kind of thing. With some of the recovery money, the TennCare Bureau has made some other proposals that haven't been chosen yet by the committee that's looking at that. But that $400 million that's really going to hit the folks who've been waiting for services, and really take some pressure, hopefully, off of caregivers who are 24/7 in pandemic trying to keep their family members safe and provide all the care for them, is going to be a really, really big deal. So we're very excited about that and really pleased the TennCare Bureau has targeted some of that to help enhance people's health and wellness.
And as this money kind of starts to trickle in, is this kind of the first phase? Are we expecting more? What do you maybe expect to see down the line?
So I think that this first push is a one-time enhanced match that creates this money. It's going to have to be spent between now and I think 2024. But the Bureau has been really committed to saying we're going to get this started and we're going to be able to keep it going. And then they have this an additional plan that they're hoping that some of the money that the state knows is coming in but hasn't planned entirely for yet, will continue to enhance some of those kinds of things. So I think that's just really going to be really, really important.
But it's good to see, right? After, again, what we've been through, to see kind of a little cause for optimism, and you think this money really could have a big impact, potentially.
Absolutely, absolutely. Particularly just really down at the local level where families are and where families are struggling, because it's not just poor people or middle-class people or even rich people. I always tell the story about Christopher Reeve, who was Superman and then broke his neck in a horse accident, a riding accident. You may remember, I'm old enough to remember all these things, right?
Oh, of course, I know him, yeah.
And so he became quadriplegic. and that takes a lot of care. He's on a ventilator. He's using a wheelchair all the time. He had a wife and family, and his care was almost $500,000 a year. And after a while, he went back. He went into directing, and he said he did because he needed the money.
Yeah.
It doesn't matter how famous or how well off you are. The presence of a disability really kind of creates some real challenges in your life and some economic challenges, right? And so having a system that figures out how we can ease that way and how we can efficiently and effectively help families and individuals, live the most productive life without just struggling through all the time is so important.
And we mentioned a little bit in the last segment we were talking, we want to pop up your contact information again, because we know there are folks out there who may need to reach out to you, have some questions, or may be able to take advantage of some of these resources and just haven't been aware of it or haven't known who to reach out to. So I want to go ahead and pop that up on the screen, but talk a little more while we pop that information up about just, that you guys are accessible and anyone can reach out to you with any questions or comments, correct?
We are, yeah. Absolutely. We are a statewide organization, as a matter of fact. And we actually, our staff, even before the pandemic, about 50% of our staff worked from home offices all over the state, because we really believe in being as local as possible, right? If you need a resource, you don't always want to have to go a great distance for it. You want to be able to be there. One of the important things that we do that we probably didn't talk about tonight, because it's not COVID related necessarily, is we have a project that's called Benefits to Work, that is just specifically designed to help people who are interested in working or who have a job offer with a disability to figure out how to go to work without risking, for example, losing their health care coverage, a safety net so that they can try work without losing all their benefits and putting everything at risk. Because a lot of people, stay on Social Security, disability, or other kinds of things because it's just too frightening to think that, that if the job doesn't work, then you've lost everything, right? And you don't have access to the very basic services and the long-term supports you need, for example. So we have a group of people on our staff who are trained and certified by Social Security, who really understand how all of that works and can really help people plan to step up and to get back to work and to do that in a way that's really safe. So that's another thing that we do. So if people go to our website, they can kind of look about the Benefits to Work program. We've got a traumatic brain injury project that's trying to help folks do that, as well as our Family Voices. We have our fingers in a lot of pies, but all of them are directed at trying to make sure that people with disabilities and their families are able to live lives of independence and productivity, and to be valued members of their communities, and that they have what we all have and what we all want, which is meaningful things to do, people who care about us, and a way to have purpose in the community.
And again, tndisability.org is that website. We've also got that phone number up on the screen. You said you can also reach out on social media, various platforms to reach you guys. You guys have a long, long history of helping Tennesseans with disabilities, and I'm sure you're not going to be stopping anytime soon.
No, I don't think we will.
What is on the horizon for the organization, just as far as your mission and what maybe you're working on next, outside of COVID or with COVID?
So there are a variety of things that we have been working on. We have continued to work to try to sort of support the families that are part of this Katie Beckett program that we had really been working on. So that's really been important to us. Interestingly enough, last year we spent a little bit of time working on the legislation around intellectual disability and the death penalty. The stuff about Purvis Payne, fellow in Memphis who had an intellectual disability who was on death row, was just taken off last week. That legislation has been really, really important to us. So we've been working around some of those kinds of issues. There are a variety of things in mental health, I think, that are on the horizon for us that are going to be really important. The other thing that we have been actively involved in right now is the governor's plan to take a look at the basic education program, the school funding formula, because again, school is so important. Kids with disabilities, we said at the beginning of the hour, I think that, about 30% of Tennesseans have disabilities, but kids, it's closer to 14% of school-age kids who have disabilities of one variety or another. And oftentimes they need some ancillary services and extra kinds of things that are really important. So we are very interested in the funding formula and the proposed changes and how you sort of tie funding to students so that kids all get good outcomes and get what they need. So I'm serving on one of the governor's subcommittees for that, and we've got other folks that are doing that kind of thing. Two of my staff are at a town hall meeting tonight talking about that. So that's going to be a really important part. One of the things that we've been working with a number of legislators on is enhancing school nurses, and we're really interested in that as part of the funding formula, because I think that COVID's kind of showed us that school nurses are kind of important. The current state funding formula in education funds one school nurse for every 3,000 students.
Well, Carol, I'm sorry, I'm going to have to cut you off there. We're getting a little tight on time here, but I want to thank you for all of your comments and your information over the last hour, and I want to encourage everyone to reach out to tndisability.org for more information. Again, Carol Westlake, Executive Director of the Tennessee Disability Coalition, thank you so much, and we'll be back to wrap things up after this.